for reminding me.
Well, now we missed Lawrence's intro then, but that's okay.
Okay, folks. So looking through the agenda, we have 5 topics to cover today. It should be a pretty lengthy site meeting, so we'll go ahead and jump in. We also have a ton of people on, 140 people. That might be a new record for a VMC site meeting. I imagine that's partially because I'm going to hit mute all real quick. We're getting some background noise. Imagine that's likely because of our first item that we have on here. Folks will have some questions about. So first item on the agenda, right, the hero pay bonus. So we actually just put an e-blast out about this a few minutes ago, which will likely answer some of the questions folks had. It's kind of the frequently asked questions that myself and Zeb have been getting the last week about it, right? So first thing to know for anyone who hasn't seen yet, the county's paying a hero pay bonus to county employees. This covers full-time, part-time, provisional, unclassified, classified, extra help. We don't represent extra help, right? The gamut. This is going to be a $2,500 bonus. What this is coming from was U.S. Treasury Department coronavirus relief direction to local municipalities. It was a few $100 million, right, targeted towards kind of reimbursing municipalities for the frontline COVID work they were doing and so forth. And the county is going to be using part of that money to pay out bonuses to employees, right? So first off, that's great news. So there's a specific window here. Folks will need to have been with the county in order to qualify, and that window is going to be June 18th or so up until, or June 28th, I think, up until November 15th. So folks who were on paid status during that time and working will qualify. Anybody who was hired or retires before those dates won't, and it will be prorated for anybody who was working part-time during that process, right? So we talked about the likelihood of this coming up at previous site meetings, just to kind of refresh people. This wasn't something that CEMA specifically bargained, right? This is just an enhancement. Therefore, it's something that the county is able to just put on offer to folks, right? Because it's just a bonus. And it's something that the county is offering equally to all of its employees, right? But we were asked, a few months back, as we discussed kind of our perspective on some of the questions that administrative had around this, right? Which was, should this be an equal payment to all employees? Should it be tied to salary level? Should this be targeted just to DSWs, for example, or just to healthcare workers? And the response that CEMA staff and its board took to Dr. Smith at the time is that it would be fair and appropriate for this to be an equal payment, right, to all staff and members. The reasoning being this is somewhat supposed to be in recompense for the hard work that folks did either as frontline workers or just kind of during the last year of pandemic and lockdown. And there definitely, if nothing else, be some optics to pay a doctor 5 times what you're going to pay custodial staff working the front line, right, for having shown up at work for the last year and a half and put their own health and safety on the line, right? So one, that the equal payment seemed reasonable, and 2, that it wouldn't be a good exercise to try and determine kind of who was worthiest. If it was just DSWs or if it was just healthcare workers, that wouldn't be a good exercise to try and kind of parse out. And one, it would take a long time too, right? And I think that not everybody would be happy regardless of where it landed. So that it was reasonable to have this paid to all county employees, and to be an equal payment was CEMA's stance at the time. We have gotten some feedback from folks who said, look, I was deployed as a DSW to work on the front line. A lot of my coworkers were able to, work from home this entire time. Why doesn't this recognize that? And I think all we can say to that is look, we all know that the pandemic and the lockdown and the work folks have been doing for the last year wasn't equivalent across the board, right? Folks here at VMC will know that, we asked our healthcare workers in the last year and a half to put your own health and safety on the line before we had effective treatments, before we had vaccination. And I don't think any payment is going to effectively quantify or capture that, right? But hopefully, folks can take this as good news and something welcome after a long year and a half. of responding to the pandemic. Last question we've been getting is that folks noted that in the Treasury payment, it's coming in two separate tranches, one this year and one in May of 2022. We've not yet heard anything from administration if they're intending to make a second bonus payment with that second allotment of money they're going to get. But that's definitely something that CEMA will be advocating for, right? Once that money's on the horizon. Some other questions we've gotten that weren't in the e-blast, folks have asked, is it possible to split this up over multiple paychecks so that it doesn't, push folks into a higher income tax bracket? Generally, no, the county is always super resistant to doing that, even when it's, in bargaining over, folks will recall the retro kind of, what do we call it, signing bonus pay that we had during the contract. County is always super resistant to doing that, anything that's going to create a higher workload for payroll, given how far behind they are right now more than ever. So no, there was no interest in the county on doing that. That being said, if it does push folks into a higher income bracket for that pay period, that's money folks will expect to see back in April at the end of the year then, right? It doesn't increase your tax burden overall, or it's unlikely to at least put you into the next tax bracket period.
So a couple of questions have come in, Adam. Let me cut in for a moment here. I'll address Greg's first and then Soledad's. I'm not sure about the provisional position, so I'd have to look that up. Maybe Adam. So Greg's comment is, and maybe you can clarify this a little bit, Greg. Hate to be cynical, but what's the catch? Well, in this circumstance, there's not a catch. We got additional money that was dedicated rather for this purpose from the feds and the state, and so the county is in sort of a use it or lose it scenario, and they wanted to disperse the money. So I guess the catch is you have to pay tax on it. If that's a catch, you have to pay taxes. So maybe that's the catch. I don't know. But yeah, I'd love to have that problem. I sadly am not eligible for this disbursement.
And I would just add on that, look, something that I think the board has recognized, substantially over the last year and a half is the degree to which, all of you, CEMA staff, mid-level managers, high-level individual contributors really held the county together over the last year and a half, right? And that was something that was done almost entirely without overtime, right? Most of our positions are salaried here in CEMA, and that, it's going to be incumbent upon, us next time we're at the bargaining table to continue to raise that issue. And like I said earlier, this at a moral level, right, doesn't capture, I think, all the work folks have done. But also that's something that we're going to be coming to the bargaining table with as I don't know if I'd call it a debt necessarily, but definitely work that we and all of you should and will want to see recognized next time we're bargaining, right? And I would expect the county's bargaining side to say, look, the county's proactive and, did in fact recognize this work that folks did, see the hero payment, right? So this will, likely be a conversation at the bargaining table. And I think our response will be that, look, this definitely doesn't capture the incredible amount of work that CEMA folks have done over the last year and a half, right?
And answered in chat, but when is it coming? The first pay period in December. I always say the pay period encompassing 12/3/2021, but usually you should see it on that date. Remember, folks, if you check your pay advice, you won't see it until one pay period later, but that's when it's going to fire, and you'll see that in your direct deposit.
Okay.
Do you know the answer to the provisional question, Adam? I'm gonna have to look it up.
Yeah, so the direction we had from labor relations, at least, was that this covered all staff, including extra help and provisional and so forth. So that's
it does cover, it covers classified, unclassified, and provisional. Yeah. Okay. I don't think I see any more unanswered questions. Yeah, I think we can go ahead and move on.
And yes, you answered that in the chat. Yes, it is. It will be taxable. Just as everything the employer pays you is taxable, right? But no, it will not be PERSable. right? I didn't see that question come across, but we usually get that question a lot. So no, this will not count towards your PERSable income for the year, right? Which means, one, you're not paying PERS contributions on it, so you get more of it, but it also means that it's not going to raise your salary if this ends up being your highest year salary, right? Okay. Let's see, next item we have on the agenda is around the exemption and accommodation process, right? Something we've been tracking for a number of months now, right? To do a quick recap, we know the county received a little more than 1,000 requests for exemption for the vaccine mandate, right? And those came from around the county. We know there were a little bit less, I think, than 100 that came from CEMA folks, right? I think it was some on the order of 70. And those exemption requests have been being processed by EOD and the EOD accommodation folks. They had a deadline. I think they were initially targeting to get them out by the beginning of this month, and that didn't happen, right? They've been working, I know, weekends and not got through all of them. But we've started to see folks get their responses back. And I think they'll be hoping to turn around the rest of them this week or so for anyone who's still pending and hasn't gotten their response back. We want to hit two things today. The first one is that in kind of the initial run up to this exemption process, what you heard from CEMA is that we were expecting there to be an extremely high level of scrutiny around the religious exemption process. And that was based on what we were hearing from county administration, county council, you know, just kind of various departments that had a stake in this kind of vetting process. However, that messaging is somewhat shifted, right, over the last month or so, for what could be a couple different reasons, right? What we're hearing is you know, an increasing level of concern about the legal liability for, you know, denying a lot of these religious exemption requests that could end up in court. Secondarily, concern that, you know, based on the jurisprudence, it's not really, does someone have a sincere religious belief, but rather a sincerely held belief, which is a point CEMA was making to the county, you know, when this process first started, or a belief that you hold with the same sincerity as someone who holds a sincerely held religious belief, right? And it doesn't need to necessarily adhere to, for example, whatever the Catholic Church's stance is on the vaccine, right? It doesn't need to be consistent with their perspective or with the Seventh-day Adventist perspective, right? It needs to be your personal belief. You know, or it's possible this was an intent on the county side to come out, you know, really strong on the messaging in the beginning. So folks will be encouraged to get vaccinated, and then they'll, you know, take that vaccination rate to the bank, and then, you know, have a more kind of wide gate than it may have initially seemed for approving exemptions, right? So one, I think we're seeing what we expect to see as a higher approval rate than we previously anticipated. Second thing we want to hit, though, and particularly relevant for folks in the healthcare setting, is going to be for anyone who's approved for an exemption. What that means is you're then shifted into the accommodation process, right? The same kind of accommodation process someone would be in if they brought an ADA request for disability accommodation, right? And what that means is that the employer gets some ability to decide what's a reasonable accommodation given the work that your code does and your department does, and what kind of accommodations are not reasonable. And we're seeing a pretty large spread in the area of how other counties and employers are responding to that. For example, we're seeing at my former employer, right? I have coworkers there putting this in place, or former coworkers are putting this in place. They're going to continue to allow healthcare workers and nurses to have accommodations that are kind of secondary measures, right? Which will be masking and, you know, getting tested 2 or 3 times a week, right? Something like that. And they'll consider that a reasonable accommodation. City and County of San Francisco, for example, coming out very strong and saying they're not going to allow any workers in a lot of their buildings. And their accommodation is going to be, you're on unpaid leave basically until the end of the pandemic, which, you know, who knows when that could be at this point. And then it seems like Santa Clara is going to come down somewhere in the middle on that, right? So what we're hearing right now from kind of health and hospital executives is that they're not going to agree that secondary measures, masking and testing, are going to be an acceptable accommodation for folks that are in a frontline healthcare capacity, right? Now, beyond that, how they're going to be defining that frontline healthcare capacity, does that mean folks who go hands-on with patients? Does that mean folks who are going to interact with patients who are likely to have, comorbidities for COVID? Does that mean anyone who's likely to be in a patient room? Kind of that level of clarity, frankly, isn't here yet, and it's at least not been clear to CEMA when we've asked. But what we anticipate is that there's going to be a decent number of folks who are approved for exemptions, and for whom the county says we cannot accommodate you in your current position, right? So what happens when the county says that, right? Will it put somebody in the position where they're then looking for a vacancy that they're qualified for, right? We know, for example, there were, last I heard, 60 or 70 frontline nurses that were still awaiting, a turnaround on accommodation. There's frankly just not going to be 60 or 70 nursing positions in the county that are vacant right now that don't go hands-on with patients, right? If that ends up being the line, which then raises some questions. One, can the county afford to have those folks, displaced right now, just from a nurse staffing level perspective? It's something they'll have to sort through. And then two, what's going to happen to those folks, right? So what we can say for now is that looking at this from CEMA's perspective, the majority of those kind of positions, for example, that are healthcare is where we're going to see the majority of these. Also positions that are in institutions, the county's taking the same position. So that would be your, juvenile hall, the jail, et cetera. Anyone who has to go hands-on with, patient in that context as well, they're going to take the same perspective. When those folks are looking for positions that they can accommodate into, and not go hands-on with patients, the majority of those types of positions are going to be CEMA positions, right? Think your utilization review nurse at, VHP, for example, requires an RN, doesn't go hand-on with patients. So the stance that we've taken with the county is that we want to see every person in CEMA get their accommodation and position if they need one, prior to folks from other bargaining units accommodating into our positions, right? The same way that folks in a layoff situation who might be looking for positions would have that level of, priority for positions in their own unit. What the exact numbers end up being, and how this is kind of parsed out as what's going to qualify as that frontline healthcare worker, we just don't have clarity on yet. It's something that I think we'll see as the individual responses start to come back, and we get through the accommodation process with folks. So let me pause there and see if we have any questions about this.
Okay, great.
So I'm not seeing any questions. Good news is, last we heard, the CEMA unit's up well over 90% vaccinated now since the mandate rolled out. So it always bears repeating every time we talk about this, right? That CEMA as a unit continues to be overwhelmingly vaccinated and also overwhelmingly pro-vaccine mandate, right? That being said, we do need to continue to ensure that the exemption process, approval process, and accommodation process is fair and respects individual employee rights as well as labor rights. And we've separately taken the stance with the county that, look, we won't see it as an acceptable outcome for any of our healthcare workers who worked on, the front line, during the pandemic and lockdown, when there was substantially more risk, to end up in a situation where there is no position for them to accommodate into. We will strongly argue that the county owes them a position, and hopefully we don't have anybody that ends up in that situation, but we'll see. Zeb, anything you want to add on the accommodation exemptions?
No, I think you covered it. I don't think there are any specific questions about it either that we've seen coming in. Let me think if there's anything I would want to add. Just look, if you're a supervisor that's dealing with someone who you may have to dismiss or counsel, please let us know so we can help as much as possible. And also, some CEMA members have already reported that they're going to be sitting in on Skelly hearings as these work their way through the system. And I would recommend getting advice and direction from labor relations prior to sitting into those. Yeah, that's all I have to add, though.
Okay, thanks, Ed. Let's see, I think next item we have is the management aide AMA MA study. Did you want to tackle that, Zeb?
Sure thing. So as many of you know, and we've been talking about this for some time now, the Board of Supervisors, it's gone through its second reading, it's already implemented. So people who were associate management analysts, this is a workhorse code that exists everywhere throughout the county, including VMC, and those who were management analysts will now be alternately staffed. So what that means is that if you're an AMA, and if anyone here is an AMA, they can message and chat me directly or put your hand up, whatever. It means that you can now become a management analyst by submitting the promotional rating form. So you don't have to go through a competitive interview any longer. That's a great benefit to you. There's also a very niche classification, which are management aides that were previously classified as an associate management analyst. They now get that third rung in the ladder, which is that they can also become a management analyst. I see Greg Sobel. We're not unmuting people because of the number of folks, but you can type your question, Greg, and I can answer it. You are an AMA. Maybe that's why you're putting your hand up. I apologize. I asked people to put their hand up if they were AMAs. Now, there was an error that I committed that I want to clarify for everybody, which is if you are a standalone management aide. So this is the way the series goes. Management aide, that's entry level. Associate management analyst is the trainee. Management analyst and senior management analyst. So you can go through that whole series. The AMA and MA are now alternately staffed everywhere. If you weren't caught, we've caught 3 so far. If you weren't captured in the ledge file, then you're getting added. And that's happening with the county for those individual cases. The error that I committed is that I misunderstood the ledge file to say that all management aides would become alternately staffed as associate management analysts. That is not true. Only existing management aides that were already alternately staffed as AMAs would be eligible to get MA status, so they could promote. So if you're a standalone management aide, you are not automatically rolled into this multi-tiered promotional system. If you are an AMA, you still are. So I'm getting a private message. Will we receive an email stating that the AMA position is alternately staffed? If you are an AMA, your position is alternately staffed. So anyone on this call that is an AMA, you should be alternately staffed.
Sorry, and just a quick note on that, Zeb. There are about 3 individuals that we identified that weren't appropriately captured in the study. Yep. So folks who were AMAs who were for some reason left out of the ledge file. ESA has been fixing those as part of their ledge file cleanup group, whatever they called it. So if you discover that you are an associate management analyst and your code hasn't been modified, reach out to myself and Zeb. What we'll need is your position number, not your employee ID, right? Your position number. And we'll be able to get that corrected, and it won't need to go through 2 more board hearings to get corrected, because it was the intent that all AMAs be covered. As Zeb's saying, it was not ESA's intent how they wrote it to capture all management aides, right? The management aides that were already management aide / AMA was what was intended to be covered. And to answer the question in chat real quick, so this does not mean that folks automatically promote right now who are AMAs into management aides, right? What it means is that your code becomes alternately staffed, which means that you can put in a promotional rating form. So you download the paperwork off the county website, right? Fill it out. You say, I'm an AMA. I've been doing this job for 1.5 years. I'm, able to do the management aide role. Your boss signs off on it, and then you're able to promote. Generally, this is something that just kind of county practice would be likely going to be in your position, longer than 1 year, maybe 2 years before someone agrees to promote you, kind of somewhere in that range. But what that does is it allows you to stay in your same position and promote. Normally, if you want to promote in the county system, right, you need to wait until a code is posted somewhere else and you throw your hat in the ring along with everyone else. And that's how you promote, right? This lets you just stay in your same position, same code, and promote in place and take on new duties, right?
Yeah, and just as a reminder too, if anyone on the call supervises AMAs, the rule of thumb is it's categorized, and the ledge file made this very clear, it's categorized as a trainee position. So you should not have a long-term AMA. If there's, a 1 to 3 year training period, then an AMA should graduate and become an MA. The AMA is designed as a trainee position. So if you're a manager of an AMA, or your AMA requests from you, and you're the supervisor, CEMA supervisor over that, says, hey, I'd like to become an MA, as long as you don't regard them as a trainee, it's completely appropriate to convert them to an MA.
Mhm.
So no, you don't automatically get promoted. It's not a right, but it is a trainee position. And if you feel you've completed your training, that's where when you want to apply. If your boss is giving you a hard time and isn't approving you, and let's say you've been in the position for 5 years, then that's where you want to let myself or Adam know, or Lawrence, and we'll come in and help you out to have that conversation with your boss and make sure that you're moving up.
So that group that Zeb was speaking about earlier, the standalone management aide positions, there's about seven or eight, I think, when we checked, of those positions with the county. And what we settled on is kind of CEMA's commitment to those folks is that come this coming year, 2022, we're going to set aside one of the slots in our classification study process specifically for those management aides, as we know many of them are functioning at a higher level, which is what the study identified, right? That we had a lot of management aides functioning at a higher level. So it's consistent at that level of analysis, right? With the finding that ESA already had. It's just that group was not included in ESA's ledge file on this, right? Or the initial scope of their study. So we'll be prioritizing and putting forward that study to study the remainder of the management aides. And we think it's highly likely that we'll still be able to turn around the same result that CEMA was initially thinking was the finding of this study, right? So of course, with the new language, folks will recall we only put forward 30 classification studies per year, and we get the 1 year turnaround time on those. So we're coming up on 2022 for folks that went through in the first batch, right? And our second window will be this coming February, right? At which point we'll be putting the remainder, like I said, those kind of 7 or 8 management aide folks that are in, the standalone positions. We'll be putting them forward as one of those 30 studies.
And also, this is something that's applicable to everybody, whether you're management aide or not, is remember that we do have those 30 slots that Adam's mentioning. It's a feature of the new contract. Every time that February window comes up, that's where we're going to be jumping up and down at the site meetings preceding that. We're going to be messaging the entire membership to make sure that if you are in a class that requires study, you get your case in front of the CEMA review board so we can advance our strongest cases.
Mm-hmm. So there's a question here I saw from Greg asking, are the specs updated on the county website?
They are.
Yes, they are. And it doesn't require that you already be doing management aide duties in order to promote with the promotional rating form, right? So this is different from what you've heard us talk about with the class study process. So when say Adam's putting his name forward saying, I'm currently a program manager 2, but I think I'm doing program manager 3 duties, so study me and reclassify me, that requires someone to already be doing those higher level duties, right? Not just that they're capable of it or that the position will be better if it did cover that full scope of duties, right? Separate question. The promotional rating just requires that you're competently doing your current position, and in this case that you're no longer at that trainee level, right? You don't require a high level of supervision. You have all the functions down, you've been trained on them, right? So it's a different metric than what you're used to hearing us talk about with the class study, and it doesn't require that you already be functioning at that higher level. Again, it requires you be functioning competently at your current level or to promote. But then you should, so sorry, just real quick, but then you should expect that you'll have additional duties added on to your position, right? After you promote. There are additional higher level duties the department can reasonably assign you once you promote from associate to journey level management analyst, right?
And it's an excellent question, Greg, and it's a subtle answer that Adam gave. Normally, when you do a promotional rating, there aren't that many alternately staffed classifications in the county, right? So normally when you do a promotional rating, it's because either you or the boss say, I want to go from a 2 to a 3, and the department needs a 3, right? You could potentially be in a 2 of some classification forever, for the entirety of your career. In this circumstance, because it's a trainee code, the only requirement is that you're no longer a trainee, and then you ought to move on. So again, there is that nuance where normal alternately staffed classifications, you just don't have to do that.
I got a private message here asking for the status on the AMA study review. So that's the study we were just speaking to. I think the person who asked this though is an analyst, a healthcare analyst. So that study is in internal review now. The healthcare program analyst, I think, it is currently in review within ESA. So it's done and it's in internal review. So we should hopefully see it soon. Was the last update we got from ESA.
Adam, I've got a couple of questions coming in directly about position classification studies. I'm going to send them to you for individual response later.
Sure.
And I think that applies to you as well, Nicole. You have a specific question about the health program specialist. Adam can respond to that offline, I think.
Sure.
And I've got another one about a different classification as well, Adam. Adam's heading up our classification committee, so he's the expert on those particular items.
So next item we have on the agenda, and for folks who have some free time to stay on after the meeting, if you have individual classification study questions, I'll be happy to stay on the site meeting and I can chat about it for anyone who has some time to stick around. Next item we have on the agenda is the an update on Real Teams / Gare. So something that was on our site meeting agenda a couple of months back is just kind of something that was going on in the CEMA unit, though at that time not impacting HHS in any way. And this was an update on what was going on specifically over in SSA, right? So in social services, they have an implementation of Gare, which is Government Alliance on Race Equity, which is kind of a training program that, you know, county employees have been sent to for the last few years or so. And their specific implementation of that training in SSA was referred to as Real Teams. And I'll get that acronym wrong. Do you remember what it was, Zeb? Race Equity something?
I don't remember.
So they have their own acronym, right? And the concern that came out from SSA, from our hiring managers over there, is that the folks who had been selected and appointed by SSA executives to be on one of these Real Teams were inserted on hiring panels and were effectively exercising veto authority over the manager's discretion for who they wanted to hire, right? Under the supposition that they were ensuring race equity and hiring practices, you know, something along those lines. So we met with, you know, SSA leadership who, you know, paused that process, and it's now voluntary to include someone from Real Teams on your panel. And the concern we raised at the time was, one, if I'm, you know, someone applying for a county position and I'm told, you know, here's Zeb from our race equity team on my hiring panel, what kind of statement can you make to me as an applicant to assure me that, you know, my race and ethnicity is not being taken into account in a discriminatory fashion in the hiring process, right? And that there should be a very, you know, clear, cogent response to that question, right? Since this has already been rolled out. And there wasn't one. It was something they said they'd work on with county council, right, to figure that out. As well as just questions about what level of authority did those individuals have in this process. You know, optics concerns with our CEMA members in SSA who said, you know, hey, I very much would have liked to be on one of these Real Teams. You know, why was this by executive appointment only? And then doesn't that seem like in our effort to ensure fairness in hiring, we've introduced a specifically non-meritocratic process, right? The hiring managers are already expected to be able to demonstrate that they were non-discriminatory in how they hire. And does this then undermine that? So, you know, the overall concern then is, right, we don't want to introduce more opportunities in the hiring process, which is already extremely legally fraught, more nexuses around which there can be allegations of discrimination made against CEMA managers, right? CEMA hiring managers. You know, I think at any one given time, I'm probably part of, I would say, 2 or 3 EOD complaints against VMC or other HHS managers. questioning whether they were discriminatory in the hiring process. And while I've never seen one of those come back with the answer that someone was discriminatory in the hiring process, it nonetheless very frequently takes a year of someone's time, right? And we'll go through 3 or 4 or 5 meetings with the EOD department as we go through the entire hiring process, and the panel's interrogated and so on and so forth. So why is it in the county's interest, our manager's interest, to make that a more legally fraught process, was our concern, right? And the update here is that entirely as was, I think, predictable and expected, we now have 3 or 4, is it 3 or 4 EOD complaints? Three. We have 3 EOD complaints that have already been filed against CEMA managers, right? Just from this initial outlay of the real teams process in SSA, right? Before it was paused. In that, this wasn't a program that, our managers at the CEMA level were particularly rolling out, or that they had ownership over, but because of their position and your position as hiring managers, right? They're the face of this process to the applicant. So they're the person upon which the EO complaint falls, right? And then it's and then they're the individual that has to respond to it, right? So unfortunately, I think the update is this is just an entirely predictable outcome of kind of what we saw as an inartful process for the rollout of real teams in Gare and SSA. So our continued push for relevance of this in HHS is that we want to see a significantly more artful and well thought out, rollout of the Gare training in HHS. And that's something that from at least my vantage, I have seen. And I've seen, for example, Carolyn Brown, who's in charge of a lot of this, be significantly more thoughtful about this process. There's good ways to do kind of this, race equity analysis and hiring in the process to, figure out how we outreach to groups that we don't get a lot of applications from. Maybe our postings just aren't finding them, underserved groups. How do we review the questions for, systemic bias, those kind of things all seem like super good ideas. However, turning the hiring process into something with more legal challenges against our managers is not something that we are going to be supportive of, right?
And the good news on this is that, of course, you'll see I even posted in chat. I don't want anyone to leave with the thought that, oh wow, CEMA is opposing Gare or is opposing real teams. We're opposing the rollout. Of course, we want to support any efforts to reduce discrimination and racism. Of course, we want to make sure that institutional racism, wherever it exists, is fought and stamped out. Introducing this doesn't help. And the other not nuance, but the other developments from the past week, everyone else who's operating Gare, have at it, continue to do the good work that you're doing. I would say don't look to DFCS or SSA for how to do it, maybe pitfalls to avoid. And then also that we did get clarification for our hiring managers that they are the final authority. So if a Gare team member, and they choose to have Gare present, which is now optional at a hiring panel, the hiring manager may consider their recommendations, but is not bound by them, which is a change. Previously, they were told they had to do what the Gare person said. Also, another benefit for our hiring managers is that they may, as I said, select to have a Gare team person present or not. Mm-hmm. So those are also good. One final instance that also was clarified, we were having some conflicts of interest where someone who's part of the real teams would put a reference as a reference, someone who was on the panel who was also in the real teams. So they were referring to each other. And that's always in any best practice in the county. Best practice, not a requirement, is that you conflict yourself out in that circumstance, right? If your recommender is on the hiring panel, you should conflict yourself out, recuse yourself from that process. There's no way you can be objective if you're recommending that person. Mm-hmm. So it's a should, it's not a must. And that was also clarified. So that put some fears to rest as well within DFCS.
Okay. Any questions on this before we move on to our next agenda item? I'm not seeing anything.
I got nothing directly, so yeah.
Okay, great. Next item we have on here is telework negotiations. So I don't know that we hit this at a previous VMC site meeting. We may have. But CEMA has coming up a second opportunity to negotiate a CEMA-wide telework policy with Dr. Smith. And this is kind of the result of some of those stances and the lobbying we did around the return to work, right, and the rollout of the vaccine mandate, kind of pointing out, hey, you plan to bring everyone back to work in May or June before we had the Delta variant. You then brought folks back, reinstituted a mask mandate, then instituted a vaccine mandate, without pausing to say, hey, what departments did we have that functioned at full or greater than full capacity and productivity while teleworking, right? That there was no pause to kind of reanalyze that point, and that CEMA's codes specifically lend themselves very well towards telework for the most part, right? That clearly the one size fits all policy has not been good as it's been rolled out. So something that we're looking for folks for is that we're going to look to have, kind of a representative, handful of CEMA members sit in this telework bargaining process with myself and Zeb, and likely a member or two from our board. So if that's something that folks are particularly interested in, we'll likely be looking for someone from Health and Hospital, right? That can kind of speak to particular issues. They're similar to how, right, we have, a bargaining team when we do contract bargaining. This is going to be much more simple, than contract negotiations, for example. But it's something that we're going to be looking to have some more member involvement in, based upon, the numerous surveys that we put out about this, as well as, the process Zeb and I have been through kind of dealing with telework policy implementation in various departments. We know there's some things that we're going to be looking for to get more flexibility in a CEMA specific policy. We'll likely be looking for some kind of, baseline number of days of telework, based upon some metric that's easily identifiable and reasonable. Maybe like positions that teleworked full-time during the lockdown, right, are clearly going to be conducive to doing at least, say, 2 days of telework, right? That might be a reasonable and baseline the county can agree to, right? As well as things like greater flexibility for how schedules are structured, particularly for our senior leaders and directors in CEMA, that maybe you can't be approved to be off every Thursday and Friday, but your executive trusts you to take 10 days a month or something like that. Sprinkle them in your schedule how you see fit, right? The current policy doesn't allow for that. If there are specific things that either CEMA folks applying for telework would like to see in the policy, or if there are things that you as a CEMA manager who's being asked to approve and deny telework requests, if there are things that you would all like to see in a new telework policy, please reach out to myself and Zeb and let us know. And if you're particularly interested in joining that process as well, the writing process, please reach out and let us know. It won't be as much of a time suck and onerous, like I said, as contract bargaining was, but it'll definitely be some outlay of time for that process. So it's not clear right now how long this is going to take. We have a couple days we're looking at so far with county leadership, but right now we don't have anything in hand. Right now, what we have is the promise to meet based upon the needs we identified. So now it'll be up to us to materialize that into a better policy for CEMA specifically. Okay, well, I'm not seeing any other questions on this topic. Last thing we didn't have in the agenda, but something I just wanted to alert folks to, went out in the e-blast a few minutes ago. There's a family-friendly event this weekend. It's a Day on the Bay. And it's hosted by one of our board of supervisors, Otto Lee. CEMA is going to be sponsoring a table at that event. So we'll have some of our reps there, right? And we'll have some of our CEMA board members there. We'll be handing out, CEMA swag and other stuff. So, please bring your family, drop on by, say hi. This is going to be Supervisor Lee's first instance putting on this event, right? This was a big event for his predecessor. So we'd like to see it as successful so far. Otto's been, very good to work with from CEMA's perspective and other union perspectives. And we want to show support to our supervisor where we're able to. So please feel free to come by and say hi to our reps or to CEMA's board, and it should be a fun event for the whole family. There's more info and a link to what it's about in the e-blast there. Folks can take a look at. You're on mute, Seb.
So a commitment I made at the beginning of the meeting was we'd cycle back for the hero pay because we saw a lot of people, and now we're up to about 50 people have joined after we have cycled on and cycled off since we started talking about that. So we will cover that in the last 10 minutes. But there are a couple questions that came in. Adam, I don't know if you addressed this one, the telework response from Renee Santiago. Adam will keep that in his quiver for just a moment. I also want to say that we, as always, want to hear from the membership about the changes we can make for telework. So as Adam said, send us your comments and questions. We also will be including a broad outreach in our CEMA e-blast for people who want to join onto that committee. So it will be a telework, I don't know what we're calling it, a telework working group negotiation committee, what you will, where we have a broad spectrum of classifications and a broad spectrum of departments, right? So for instance, while we love our TSS folks, we don't want to just have 10 people from TSS, right? We want to have a nurse, an accountant, an IT person, a road supervisor, whatever it might be. So we get real breadth and depth in terms of who telework's working for and who it isn't.
We had a question there from Jenny in chat asking about the upcoming raise for nurses. Yes, that's 2 pay periods out, I want to say. That are nursing classifications who are aligned with RNPA will be seeing their 3% increase shortly. Again, these are the folks that wouldn't have seen an increase June 28th earlier this year. You'll be seeing it 2 pay periods out, I believe. Should be a 3% increase. So if for some reason you fall through the cracks on that, please reach out and let us know. Though at this point, I don't think there should be anybody, because we're a few years into this now, right? So I think in the first raises that came out, there were some folks that fell in the crack and missed getting either of them, but that should all be corrected by this point. All right.
I think that's it. Is that correct, Adam?
Yeah, I don't see any other questions. So for folks who are interested in staying on, I can address those individual classification study issues, and I can talk about HHS finance telework real quick as well. But otherwise, there won't be any relevant information for anybody else. So thanks for joining.
So let's though hit that hero pay again, Adam, for the people who joined late.
Oh,
so and if you've already heard this, you've already heard the hero pay. Thanks for the amazing turnout. We had a really strong, I think we passed 180. Thank you for all taking time out of your day to join us and get these updates. A good conversation as well. We're going to go into hero pay again. Please hang on if you want to hear about that once again or have specific questions. Otherwise, thank you for your kind attention and have a wonderful afternoon. I think it is already.
Yep. Great. So hero pay, the highlights. Yes, there's a hero pay bonus coming to all county employees. This covers CEMA members as well. The requirement is that you be here between it was June 28th of this year and November 15th. So folks who retire or resign before then will not qualify, and folks hired after that point won't qualify, right? The goal was to capture some swath of COVID, related time, right? It'll be prorated for folks who are part-time. As is always the county's position, they'll care about what your FTE is, not what you're effectively working. So someone who's a 0.5 but picks up a lot of extra hours, the county will not agree that you're full-time. It will be upon whatever your coded FTE is. There are very few part-time employees in CEMA though, or less than a dozen. But if that's you, that will be the county's perspective on it. This covers, the range of folks from, provisional and extra help to, unclassified and classified, et cetera. It won't be prorated if you were on leave during some time, but the county's taken the stance that if you were on, paid administrative leave for the entire breadth or unpaid leave of absence, something like that, then you won't be qualifying, right? You needed to be on some kind of paid status working during this window. We had some questions earlier, kind of what's the catch on this? I would say generally there is no catch. This is just good news. CEMA was asked for our position on this. We didn't bargain it specifically. The county's not obligated to bargain it because it's just an enhancement of benefits effectively, right? The county is fully welcome to just pay people more money than what's bargained if they want to. That's what they're doing here, right? But we were asked, our perspective on, should this be an equal payment to everybody? Should it be tied to your salary level as a percentage of salary instead? And should it be given to everyone equally, or should we target it specifically, for example, to DSWs? The stance that CEMA staff and the board took to administration when we were asked was, it seems fair and equitable to have it be a flat rate payment to everybody, as opposed to having, some staff, for example, that work in the front line in the hospitals get a payment that's, 1/5 of, what, one of our psychiatrists or MDs gets, something like that, right? And that it wouldn't be a good exercise to try to determine who was worthiest and who should receive this and who shouldn't. Do we say that only DSWs get it? What about healthcare workers? What about healthcare workers that were able to telework? Did they then not deserve it? What about someone who themselves wasn't a DSW, but 3 of the 4 staff in your department were all deployed as DSWs, and you've been working 80 hours a week to hold down the fort while, you've had folks in your department doing contact tracing, which has been easier than a lot of other DSW deployments, for example. It basically just wasn't going to be fruitful to try and parse that out, that it wouldn't be effective, that some folks would be left out who shouldn't have been left out regardless, and that it was reasonable to say, this is a recognition to everybody and at a flat rate. And we've had some folks who said that's disappointing. They would have expected to see something more, for example, for frontline healthcare workers, for people who had the difficult DSW assignments, for example. I think all we can say to that is that this, of course, doesn't capture, everything that, folks in CEMA have done over the last year and a half, holding the county together and holding county services together. But it is, I think, a small recognition of that work, right? So that's what we'll hope folks take it as. You're muted, Zeb.
And to answer a few of the questions that have come in about the compensation nature of it, yes, of course, it's taxable. Also, there seems to be some misunderstanding that if it was in a separate check, that then somehow it wouldn't be taxable. That's not how it functions, just so everybody's aware. What it means is that the employer may not have taken the money out of it at that moment, but you're still liable for the tax burden on that at the end of the year. So there is that slight nuance, but regardless, you're going to end up paying taxes on it, no matter how it's dispersed. And then there was a question in the chat, which I think we answered previously, but if someone was on leave, are you eligible for the hero pay? Yes, as long as you worked a day fully paid during that period of time between June and November.
Yep.
There's a question now here, Adam. Is there an option to have the 2,500 distributed to our deferred comp instead of a payout? So there's a nuanced answer to this question. No, not directly. You could increase the amount of money you deduct for deferred comp for one pay period, and the pay period encompassing December 3rd, anticipating the $2,500. So that's something you could do. It's just, it adds a new level of complexity to the scenario. But it's a great question, Grace, and you clearly have an understanding of your deferred comp and how to manipulate that. And obviously you don't want to exceed your maximum deferred comp for any year.
Yeah, and just as a reminder that this was a frequent question when we were talking about the lump sum payment during negotiations, and some folks timed it incorrectly because of the confusion about kind of what pay periods are referred to as what, and felt like I guess a bit of a moving target at the time. And so some folks had, their increased deferred comp went into effect like the pay period after the one they were hoping it was, or the pay period before. And that ended up being a bit of a mess. So yes, you can do it, but consult with someone in payroll or one of your HR folks to make sure that you correctly get the pay period you're looking for. And there needs to be a certain amount of lead time as well, as I recall, to have that change put in place with your deferred comp provider, financial entity, whatever you call it. Yeah.
Okay, well, we're right at time. Thank you, everybody. Thank you to the board members. I see joining us was Jesse Castaneda, who came in situ, as it were, and we've got Jim Piazza as well, who's waving at everybody.
Hello,
Have a good
everyone.
afternoon, everyone. I don't know, are you
Thanks,
staying on?
Thanks, Alan.
Yeah, I will be on, and I'm going to stop the recording.